For this Sustainable Development Goals exercise, we're going over Sustainable Development Goals 3, Good Health and Wellbeing in the Philippines. This data story has been divided into two parts, explaining what good health and well-being is, the data, and the root causes before we get to the X mind map. Good health and well-being is taking steps like exercising well, eating foods that benefit your nutrition, ensuring you have access to clean water, and finding your purpose in life. It is also resting when you are injured or sick with diseases, managing stress, regulating your emotions, and connecting with other people. As one of the 17 Sustainable Development Goals, the United Nations defines Global Goal 3 as to ensure healthy lives and promote well being for all at all ages. Global issues pertaining to good health and well being are rooted in infectious diseases such as HIV and AIDS, tuberculosis, the Ebola virus, and malaria, and non communicable diseases like cancer and cardiovascular disease. In some areas, poor diet and inadequate exercise play a major role in lower life expectancy, as well as mental health risks, substance abuse, traffic deaths, air pollution, obesity, and mortality rates. These are all significant areas of worldwide concern. In 2023, the total population requiring treatment for neglected tropical diseases in the Philippines was significantly higher than in the US, at almost 50 million people. This is the X Mind map. It tells you the definition of good health and well being, the causes of poor health and well being, the data, and the IoT solutions all in one picture. Let's look at the data first before we go over the solutions. In the Philippines, you have HIV incidences 2022 in the 15 to 24 range compared to the US, which is 0.15, the Philippines has 0.55. For the 15 to 49 range, 0.17 for the US, 0.40 in the Philippines. The diseases. These will be covered in the other slides. But I want to go over the ones where the closest data point is 2015. These are the closest data points to 2020. So let's look at hepatitis B in the Philippines. That is 1.07% compared to the US, which is 0.04%. Let's look at the IoT solutions. Let's look at healthcare first. In telemedicine, the Philippines uses IoT sensors that allow for doctors to monitor patients' health remotely. And you have these IoT devices like wearable sensors, laptops, tablets, and other connected medical devices that help track conditions. IoT also provides insights to reveal patterns in diseases, epidemics, mental health, and lifestyles. In agriculture, IoT sensors are used in pest and disease management so crop losses are reduced. Early warning signs can detect health hazards to produce, monitoring food safety to prevent disease, and prevent food contamination. Smart irrigation systems and soil monitoring are ensured and installed to optimize public health and prevent water and soil contamination. In air and water quality control, let's look at air quality first. Pollution monitoring via IoT is used in various vehicles, and initiatives are launched to enforce air quality laws so illness and death decline in numbers. Meanwhile, in water quality, IoT water quality robots are programmed in remote areas to assist with disinfection investigation with water shortages, and identification of pollutants. IoT and transportation safety. Let's look at roads. The Philippines uses IoT smart sensors to detect unregistered vehicles, crashes, and other hazards through vehicles to everything, and investigate structural issues on roads. In airports, RFID tags and IoT sensors are programmed to track baggage, detect prohibited items in screening, and manage weather conditions and air traffic. Let's look at the child mortality rates in 2023. This is the estimated share of newborns who die before reaching the age of 5. In the United States, this number is 0.6%. Meanwhile, in the Philippines, this number is 2.7%. That's higher than that of the US. I have two graphs here. HIV incidents per 1,000 individuals by age. Let's look at the data in the Philippines. In both graphs, this is the number of new HIV infections in each age group per 1,000 uninfected population in each age group in both the Philippines and the United States. In the Philippines, we're not going to look at the all ages one because this is not listed in the United States data. But at the 15 to 24 years, that line has gone up, as well as that of the 15 to 49-year age group range, although it's not as high. So it's not to the extent of the 15 to 24-year age group. In the United States, these lines are in steady decline. Notice how the 15 to 49-year age group is higher than that of the 15 to 24-year age group. This is the United States data and the Philippines data. This is the share of children with an active hepatitis B infection in 2020. However, this data is from 2015. This is the share of 5-year-old children who test positive for a marker of infection called hepatitis B surface antigen, and a positive test for HBsAg indicates an active hepatitis B virus infection. In the United States, this is 0.04%. In the Philippines, that is 1.07%. This is the number of people requiring treatment against neglected tropical diseases in 2023. This is the estimated number of people requiring medical treatment for neglected tropical diseases, which is abbreviated as NTDs. In the Philippines, the number is 49.5 million. In the United States, that is a very small number, 525. These are the reference sources. All sources came from ourworldandData.org.